But where are we today? You know, today we are not on references. Today we are, you know, we need to have more transparency. We need to have more honest conversations. It is really unbelievable to me that you can look up the price and quality of near anything you want to shop for. A car, a stapler, a pencil, anything. And you can research it and then you can make a decision. Maybe you want to pay more for a specific car because it has more features, or it's, you know, it has some of the perks you want. It's not always, we don't always go with the lowest price. We don't buy plastic staplers. I mean, that's not helpful. It's going to break down, right? So we need to have information so we can be better consumers, better shoppers of care. We also need price transparency and quality transparency so that we can implement policy changes that make sense. We have all these discussions at the State House about healthcare costs are going up, and it's taking away wages from employees, and employers can't afford it anymore, and we're on a non-sustainable track, and we will have all the data this morning to show you these things. But I'm super excited today to share with you something brand new that we've been working on for a year. Actually, it's been longer than a year. I first presented at the National Alliance of Healthcare Purchasers Coalition, Mike Thompson's group, in front of my colleagues. So I head up the Employers Forum of Indiana, but there's one of me or two or three of me in almost every state. And all of us have been having a conversation, and some of you are here in the audience today and online. I think over a dozen of you are. We're all having the same conversation of how do we steer patients? How do we create benefit plans? How do we create payment models that go to best quality at the best price? And so when RAND first came out with their hospital price transparency studies, we were like, wow, look at all of this wide variation. You know, we really have an opportunity here. Now we just need to find the quality. You know, we're starting to peel back that onion. So we today are going to peel back the onion a little bit further. Sage Transparency, we've been actively working on this. It's a hospital value dashboard. This dashboard is going to be freely and publicly available to everyone. It's going to be freely and publicly available to everyone. So I'm just super excited about that. There are other solutions. They're all proprietary. We don't have anything that exists that has publicly available price and quality information side by side. And I'm going to show you, we're going to launch it here nationally, I'm told any minute now, and then you'll be able to check it out yourself, but I'm going to show you a preview of it now. You're going to want to spend some time with it. Okay, so it is not only free, it's an interactive website. It's customizable. You can print out PDFs. You can go and have conversations and just have more honest, transparent conversations with all of the partners, the whole supply chain, from your benefit consultants, employers to benefit consultants to carriers to providers. There are a lot of awesome providers. They want to be part of this solution. Many of them are stepping forward, and you'll hear from some of them today. So this is going to allow us to have more honest conversations. It's not going to get us all the way where Hunter, the vision of where we need to get, but it's foundational. We just have to have it. So let's keep going. So I also want to thank the Employers Forum of Indiana work group. We had a beta test that we developed for Sage Transparency last year, and we knew that wide variation in hospital prices and quality exists from some of the other RAND studies, and everyone wants to go to best quality at best price, but how do we make it easily accessible and useful? And you guys know, I don't know, those of you who know me, I don't like Excel spreadsheets, and Dave knows that the best. I can hardly make one work properly, and so I need pictures, I need graphs, I need something easy and simple to use. We had a work group made of a dozen folks, all multi-stakeholders, so we had hospitals and employers and insurers, all providing input and feedback into this. So, I'm so pleased to introduce to you Sage Transparency. It is comprised of 5 data sources. So initially we wanted the RAND prices and CMS hospital quality data together. That's how the conversation started. But as more and more of you and our partners and that are in the audience, and you'll hear from all of them, started developing really awesome tools in their own transparency, we just, we asked them, could we please bring your great work into this transparency tool? So we have 3 public data sources. One is RAND 4.0. Now, RAND 4.0 was supposed to launch today. They had a data update on Monday. And so we had a team, and I just can't thank the Mathematica team enough. They have been such a great IT partner with us. They've been working round the clock along with the EFI team. We did all the quality checks, and we are incorporating in Sage Transparency RAND 4.0 hospital prices, even though RAND 4.0 will be releasing their report at some point. So it's in with RAND Publishing. All their data is final. It's just going through the publication process. RAND 4.0 has a lot more information in it than what we're presenting, what we've incorporated. We just incorporated the hospital prices for over 4,000 hospitals in the country. Uniquely, RAND 4.0 this year also has ambulatory surgical center information. So we are going to be reviewing that more carefully, and then we will incorporate it into Sage Transparency once we understand it a little bit more. Nashby, Marilyn's great work. She's been working on this for years. I mean, really years. And we were part of her beta back in the day, along with Colorado and Texas. And it's just been amazing to see this commercial break-even tool go from being an on-paper experience that she could get through in 20 minutes, that Dave could get through in about 2 hours, and then I could never get through. So I was just always calling them. So we wanted to, and she's been working with other partners, and you'll hear from her as well more about this tool. But we've incorporated just a couple of pieces of information from Nashby. To learn more about it, you'll need to go into the Nashby dashboard. It's got a ton of information, a ton of financial information, including a 10-year look back. And we just have 2019 information that we're sharing. CMS hospital quality ratings, these are public. They are updated on a quarterly basis. As such, we are going to update this dashboard on a quarterly basis. When Nashby makes an update, we're going to make an update. If RAND makes an update, we will make an update. Turquoise Health is a proprietary solution. It's brilliant what they have done. And there have been some others, but I think they were maybe the first at it, and they have a really huge database. So hospitals are required by law, federal law, to post their prices on their own websites at the plan level, the negotiated prices, not the charges, but actually what the negotiated rate is with Anthem, Blue Cross Blue Shield, HMO, PPO, etc., with United Healthcare's different plans. All of the plans need to be posted what the negotiated prices are. But that's thousands and thousands of procedures and prices and plans, and it's really challenging, again, for someone like me that doesn't like to look at a super ugly spreadsheet, to make any sense of it. So we worked with Turquoise Health, and they've just been an awesome partner. So first of all, if you love spreadsheets, they have it all, and you can get it all directly from them. And it really is amazing because they went to all the hospitals' websites and pulled down their machine-readable files and cleaned it up and made sense of it. So they've made it easy to use at the procedure level and at the plan level. What we wanted to do was not have it all be at the procedure level. What's challenging when I have gone to the hospital websites is because the federal government has not come up with a fixed data dictionary to help the hospitals, it's a real problem. If you look up knee replacement at hospital A, it may just be the facility price. Knee replacement at hospital B may be facility plus physician, the surgeon's price. It could include the anesthesiologist and or the device. So they're not really an apples to apples comparison yet. My hope is, some of the work that, the folks here online and the audience are working on is to get a fixed data dictionary so that we can all be taught. When we say knee replacement, it means the same thing across the board. That will help a lot. Right now, because we don't have that, we are rolling things up into clinical categories. So we have orthopedics. So even if it was facility, surgeon, device, whatever, we're rolling it all up into something called orthopedics, cardiac, transplant. So those are the clinical categories, and that's why you'll see clinical categories on the dashboard. Another opportunity is that we have posted, there are prices that are available, and then there's percent of Medicare. So prices are helpful, but sometimes it's difficult to interpret a price. You know, you might look at 5 places and let's say a procedure's $5,000. Is that a good deal? I don't know if it's a good deal. You know, if someone told me it was 125% of Medicare, I'd be like, that is a good deal, you know. If someone said it was 500% of Medicare, I'd be like, that is not a good deal, you know. So I need it, and I need it all prices organized in a way, whether you're negotiating or not in terms of percent of Medicare, which is a fine way to negotiate, but if you want to negotiate in terms of dollars for bundled payments or episodes of care, you still should convert all of your information, your prices, into percent of Medicare so that we're all talking the same language. Posting prices is important, and you can see Northwest Radiology, I think the first organization here in Indiana, they post their prices. They're just posted right there for you, and nobody pays a different price. It doesn't matter what plan you have. It's just amazing. I walk in there, I take my mom in there to get her procedures, and there's a big sign, and that's what we pay. And why can't it be like that? It should be like that. I would like to see quality and price as we go on and we get better and better at this. Quantros Healthcare Blue Book. So Quantros was a separate organization. Shane Wolverton is here somewhere in the audience. He knows loads about Quantros and really was the founder and developer of it for I think 30 years. So it's a tremendous data resource on quality. So it's another quality opportunity for us. Healthcare Blue Book used Quantros, and then they purchased Quantros in February of last year. So Healthcare Blue Book is a really unique proprietary solution. We are just using a few of their measures. They provide a wide suite of services, but we're just pulling from certain quality measures. So when you look at Sage Transparency, you're going to hear about, now you might have a lot of questions about all of these things and what's in it, what's not in it, what are the outliers. We're going to hear from all the speakers. So this will be your opportunity to ask them any questions that you have about, hey Chris, what is what types of prices do you have in Turquoise Health, or what can I or can't get? Can I not get? Okay, so that's what's in it. Are you guys ready? Yeah, you ready? Okay, let's see if this works. Fingers crossed. Okay, I'm supposed to minimize this and then it's supposed to be there. There it is. Okay, so introducing Sage Transparency. This is an awesome day. I mean, you know, wedding, birth of my kids, Sage Transparency. Actually, I have a daughter named Sage, so she's really tickled pink, but, she was a C-section kid, so as hard as it was to have her, as has it been to bring this to you guys. But I want to just share with you what the tabs are, just a preview, but you're going to have to spend some time with this. So, we have a states tab, we have a clinical categories tab, and it just refreshes all the time. A hospital by states, a hospital by systems, and a hospital directory. So you will see different information on each tab. It's like, what are you looking for? Are you looking for just a specific hospital? I want to know everything about this hospital. Price, quality, go to the hospital directory, type it, over 4,000 hospitals. Okay? We're going to have some fun with this later. You're going to get to tell me what you want me to look up, because I don't know what to look up. There's just a lot of information here. If you're interested in hospital systems, we have over 250 hospital systems in the country. We can just go pick one, and you can see Ascension Health in all the states. What do their prices look like? How are their prices varying? Maybe we'll look at that one, or HCA, or one of the other ones. Hospitals by state. Maybe you're just like, I want to see all the hospitals in Indiana. How do they compare? Or maybe I'm an employer and I have business in 2 states. You don't have to pick 1 state. You can pick 2 states or 3 states. We also have this regions section. So regions is unique. So here we have, for example, clinical categories. this was, I'm getting ahead of myself. Okay, let's start with states. That's the highest level. This is showing just RAND 4.0 information that will be published soon, and that Chris Whaley will be talking more about right after me. So I picked, it defaults to 5 states just because we're Indiana and these are the states around us, but you can pick any states you want. You can select all the states, or you can just click on whichever states you want. So we have all 50 states in here. We have 9 prices. So in RAND 3.0, we had 3 prices. We had 7 prices. For our transparency tool, RAND, Chris Whaley was just so awesome. I had so much respect for his work. He was gracious enough to break down the data further and give us 9 prices because I really wanted to have physician fees broken down to physician inpatient and physician outpatient. We have a unique problem here in Indiana, which he will share with you in a few moments. Okay, so I picked total facility plus physician. That's everything. It's inpatient, outpatient, and physician fees all together. And we can see what everyone's rankings are. You can see on the side here is a heat map. You can see who the 3 highest priced states are. You can see who the 3 lowest priced states are. Just easy, right? Here are all the states rank ordered for you. All the graphs are interactive. So if you click on this, you have to click in each of these graphs. You can do kind of some cool things. You can expand them to make them bigger, and then you can print just that. You can reorder them. Maybe you want it lowest to highest, and so it will just it'll just sort for you in a different way. So this is some state information. We also have state information on NASHB stuff. Remember, NASHB, the National Academy of State Health Policy, they have the break-even number. So to keep a hospital whole based on their own information that they provided to the federal government regarding their own costs, not arguing about what their costs are, not arguing about any CEO salaries or anything, as they report them to the federal government, what would an employer need to pay them as a percent of Medicare to break even with no profit or loss? And we'll hear more about this. I just want to point out that in Indiana, we have the 3rd highest costs. Our hospitals' costs are high. Why are they so high? That's really worth asking ourselves. I can understand maybe why California is high. I'm not really sure why our hospitals' costs are high. So our cost for them on average to break even is 161% of Medicare. I'm just going to scroll back up. 161% of Medicare. Our prices are, where are we? Here we are, Indiana, 292% is our average. We have this information broken down by hospital. So when you're having conversations with hospitals regarding what's a fair price, because that's what we all want to get to. We want them to be successful. We're not trying to shut down any hospitals. And this doesn't apply to the rural hospitals, and you'll see that. You can see which hospitals are the problem hospitals, because you will see, why don't we just do that? So you will see, we can see it. Let's do hospitals by state. What state should we look at? It defaults to Indiana. Anybody want to see a different state, or should we look at Indiana? Oh, I heard Indiana and Texas. We'll do them both. Okay, so we have Indiana here. So this is a lot of hospitals. The blue line is what we're paying, and if you hover over it, you will see what hospital is, their hospital ID number, the state, and their price, their total facility price. Now this is facility, inpatient, outpatient facility price without professional fees. Some of these are 500% of Medicare. It's really unbelievable. But not all of them. Look, some of them are not. They're reasonably priced, I would say. Here's some now under 200. So we need that information. The green bars are NASHB's bars. So NASHB, again, let's say this is too many to look at. So we don't want to look at the whole state. Let's just say we want to look at oil. Why is it showing? Oh, they're in multiple states. Well, let's just do Bloomington. I don't know how many hospitals are in the Bloomington area. Oh, it's a smaller town, but there are 3 hospitals. And we can see there's Monroe Hospital, Indiana University Health Bloomington, Bedford, and Ascension in Dunn. So you can see the variability in prices, and you can see the NASHB number, and that difference is where you can start having conversations about what's a fair price. I'm not saying that they should be paid their cost. They need to make a profit, but do they need to make, when most businesses are super happy with a 3% profit or a 5% profit, they'd be rolling over in gravy if they were making a 10% profit. Some of these hospitals are making 100% profits. That money is coming directly from employers and families' pockets. So it's very important that we have this information just to have more transparent and honest conversation so we can all shop for care. Okay, so that is, once you select that information, let's see, someone said Texas. Let's just do Texas and see what we got. We have a lot of information. Where's Indiana? I have to unclick Indiana. And then I have to find, I think I can just type Texas, but yes, type Texas. And if we select it all, you would see we have a lot of hospitals from Texas, so we don't want to select all. It's not a pretty graph, but let's just unselect all. And Chris is from Houston, right? So let's see what Houston's doing. Okay, so we still have a lot of hospitals in Houston. But you can see what the variability is between, there's one hospital that's a little out of control. Chris, you might want to get on top of that one. I mean, it's like 700%. So I won't put my cursor over them so we don't like call them out, but yeah, you can see who they are. So you can also select by systems. You can select by star rating. Let's say you just you don't want to see all the 1 stars and 2 stars, the lower quality ones. Maybe you want the best price and the best quality. So let's look at the 4 and 5 star hospitals. Okay. So look, here are the 4 and 5 star hospitals, and now you have their price and now you have their cost. It's just easy. You're like, okay, are these in my geographical area? That you have to go to a different tab, and I'll show you that information. So this is also this one's about quality. So those same hospitals now populate here. This comes from Quantros, and this is quality scores. They're stacked per hospital just to make it easy to look at, but they're not stacked in theory. Each one is based out of 100 points. So you can see Houston Methodist and Houston Methodist Sugarland Hospital. Out of 100 points, their overall surgical quality care is 99.5. That's really amazing. Their overall medical quality, 98.6, amazing. And their overall surgical, really amazing. Their prices are high at 300% of Medicare, but you can see their quality is pretty good. So that means something to all of us, right? We want to go to the best quality, best price. However, some of these are going to be higher priced, and you're going to get that from the top one, and their quality might not be, this is not 300% of Medicare. This is just the stack of 300 purely on quality. We would have to go up higher to see, what their prices were. But we do have opportunities where you can put this information side by side. And here it is. So if you want to look at a spreadsheet, you can export this. And what we did was we've just selected 4 and 5 star hospitals. So here they are. Here are all 9 prices. And here's the NASHB break even. So it just makes it easy to kind of scan across if you don't want bars. And these are all the 4 or 5 star hospitals in Texas, listed by name. This is their ID number, their hospital name, CMS star rating. These prices, 9 prices, come from RAND 4.0, and this is NASHB's break-even price. Pretty amazing. Okay, let's go to hospital system. It defaults to Ascension just because it's in alphabetical order, and it defaults to all states. Give me another state that Ascension's in. Michigan. Okay, unselect all. Let's pick Michigan, and let's see. Okay, so they do have a lot of hospitals in the Michigan area. And actually, if you wanted to compare them, should we compare them to Indiana? Yes? Okay. Let's see what happens. I don't know what's going to happen. Okay, so here we have the Indiana and Michigan Ascension hospitals. This one is St. Vincent's Kokomo in Indiana. This one is Indiana. Okay, now I'm just going across here. This one is Michigan. Okay, so they do have, these are over 400% of Medicare. These are the NASHB numbers, but we have some other ones too. So you'll want to look at their quality, and there's a wide, so even within a health system, even within a state, the prices are so variable. The quality is so variable. We have to be smarter consumers and shoppers of care. This tool is really just meant to help everyone do that. It's not secret sauce. It's not really supposed to be proprietary. It's quality and price transparency. We all deserve it. We should all have it. And I'm committed to just making this happen, updating it quarterly. It's going to be around for a long time if Hunter believes in it. And others. And so I want to show you this is the hospital directory. So let's say you want to look, give me a hospital in a state. Mayo Clinic? Is that what I heard? I think I heard that. So Mayo is in Rochester, Minnesota? Minnesota. Okay. Oops, I have to iPad. Let me just see if the search button works good. Okay, M-I-N. Oh, yes, it does. That's so much easier. All right. So let's pick a hospital. Now, this field doesn't clear. That's a little something we're working on. But we know it's there. We're going to have to ask Amazon QuickSight, this platform which it's built on, how to get rid of it. Okay, well, let's see. Let's just type Mayo. There's too many hospitals there. M-A-Y-O. Okay, well, now they have a whole bunch of Mayos. Is there a particular Mayo? Oh, you said Rochester. Okay. There we go. Here's the address to make sure it's the right one in Minnesota. There's their zip. And what you can see here is some really cool stuff. This is their payer mix. This comes from NASHB, and you can get a lot more information about payer mix and just go to the NASHB website. And from our glossary here, you can get there. But you can see they have 50% commercial lives, 33% Medicare, 9% Medicare Advantage, 7% Medicaid, 1% charity care, and 0% uninsured. So when hospitals are saying we're providing a ton of charity care, are they? Are they providing a ton of charity care? You can now look it up. How much are they providing? Some of them I've seen are providing, 3-4%. I don't know. I didn't know what is normal. The way I hear about it, I really thought charity care was like 10%, 15% of some of these hospitals' business. But I haven't found any hospital that has that number. So it's interesting, Also, some hospitals will say we cannot make it on Medicare and Medicare payment alone. We cannot. We have to charge the employers more for it to keep us afloat. There are two questions here. Is it the job of your employers in your hospital community to pay for everybody, for all of your costs? That's really a fundamental, foundational question for us. Why is it the small businesses in your community's responsibility to pay for everyone? They should be paying for theirs, and they should be paying a fair rate for theirs. Why should they be paying for everyone else? If you're not getting a fair rate from Medicare and Medicaid, take it up with them. Anyways, that's just my personal opinion on that. But that's for a later date. What we're doing here is employers are picking up the tab and they want to keep their hospitals whole. They provide enormous services, valuable services. We need them, we love them, and we want them to be successful in our communities. But we really need to think about payment altogether. It is not just the employers and the families in that community that should be funding the entire hospital system. If they're not making it on Medicare and Medicaid, and Marilyn's going to tell us how you find out if they are doing fine on Medicare and Medicaid. Moving on. Here is star rating. CMS has patient experience, and it's 5 out of 5 stars. So Rochester, Mayo Clinic doing really well on quality here. Oh my gosh. The Mayo Clinic, it was fiddling around with this. I didn't see anyone that had such high scores before, but this is overall hospital care, overall medical care, and overall surgical care from Quantros, and you can see, again, they are really phenomenal. So let's see how they're doing on price. Well, this is their prices. We just have 4 of them. If you guys want more, let me know. We are, like I said, going to be making updates quarterly. There's a feedback button right down here, so you can fill it out. But you can see here the state benchmarks for Minnesota, and here's the median of all states in the United States. So let's look at their total facility. They're at 307%, okay? Minnesota's at 286. The national average is 260, so they're at 307. These change, the y-axis changes, so even though this bar looks lower, you really need to put your cursor on to see that they are indeed higher. This is their outpatient at 471. Minnesota's state average is 345. And then the national median is 260. So, I know a lot of hospitals are interested in direct contracts. Maybe there are some opportunities. Also, you can work with your carriers. They have this information, you have this information, and really start having more transparent and honest conversations. Okay, so we talked about the health systems tab, the hospitals by state, clinical categories. I just will briefly show you. You can shop for specific things by categories. You will see some blanks, and that's because the hospitals have not posted the information on their own websites. So if it's missing and you're looking at the turquoise health bar, it's because it hasn't been posted. It should be posted, but it's not posted. So I would encourage hospitals that are listening, please review your information, and if it's missing, Turquoise Health is updating it. I think they do updates, I don't know, daily? Every day. So they do updates daily. I don't get it I get him an aggregated report from Turquoise every quarter, so we will refresh it with updated information. Okay. Now, what do you guys think? I'm so pleased that you like it. Please tell me more. It's now live. You go to sagetransparency.com. We are going to have a break, and you can check it out. So Sage Advice brought to you by sagetransparency.com. And this is just a slide showing you all the special little features. And our disclaimer, I'm not going to read this to you, and we do welcome feedbacks. So I just want to tell you what's on the horizon for Sage. We are, over the next few months, going to be adding to it. We're going to be adding RAND 4.0 ASC information, adding insurance data, because the insurance companies are required to post their prices, negotiated prices. Once that gets cleaned up, we'll do that. We're developing a private dashboard for forum members that will have additional information, and we really need to do more on quality. I would like to personally do work on quality, have it organized, have more transparency in that space. So that is what we are working on. Again, thank you to Arnold Ventures, and a really special thank you to all of the Mathematica team. I talk to them all the time, and they are phenomenal. They come from a place of yes. They had maybe 1,000 times to say, it's not in your contract, it's not in your scope of work. Sorry, we can't do that. I was like, can we do this? Can we add this? Can we do that? And they always said yes. I mean, who says yes all the time? But nobody. I don't say yes all the time, but they say yes all the time. No pressure. I know they're here, but you don't have to say yes all the time, but they have said yes to me all the time. So thank you so much. All right. Any questions about Sage Transparency, the tool, not the data? You're going to hear from all the data sources shortly.
Gloria, we've had a couple online questions, and maybe you could clarify for the in-person audience as well. Several questions came in around how do we know how much data is represented out here? So, over the years, as we've done the RAND study, we've gotten more and more data from each state. So a lot of questions around how do we know how much data is out there for my state or that specific provider?
It's a great question. So we have a state tab, and you can pull down all the hospitals, and it will show you all the hospitals in that state. So it has changed over time. We got a lot more data in RAND 4.0 than we ever have had before, and Chris will kind of go through that, so you'll see there is more data. So if your hospital wasn't in RAND 2.0 or 3.0, see if it's in RAND 4.0. If it's not, I believe there's going to be a RAND 5.0, so you can work with the employers in your community to get the claims data to RAND to be in the next study. Any other questions? Yes. Do you mind getting to a mic, if you don't mind, so the online audience can hear your questions?
Thank you. Just a quick one. It all looks really, really impressive and fantastic, so thank you. And just a question about the break-even data that comes from NASHP. Did you decide to go with something that shows break-even across all of a hospital's revenue and all of its costs, or maybe break-even just based on costs of care? NASHP has a few different categories of that.
That's such a super question, Jim, and you would ask that. So, because you're a data guy, and I appreciate that. You know what I'm going to do? I'm going to kick that to Marilyn because she will give you a much clearer, better answer than me, but we will answer that question.
I'll use break-even level 3.
Oh, you want to, there's a mic on the table.
Thank you, Gloria. Excellent. This is incredible what you have created here. Congratulations. We're using break-even level 3, which is the hospital or what commercial payer would have to pay to cover their patient costs, cover any shortfall on Medicare or Medicaid, cover charity care, uninsured costs, any Medicare disallowed costs, and we bring in other income, investments, joint venture income. So it's fully loaded. It's the highest amount possible. So when you see that, you know that it's not just the hospital operating costs. Okay.
Thank you, Marilyn. She had different levels, but decided to put it all in, so it's very generous.